We all know that Dr. Google is not our friend, yet Canadians often flock to it to find answers to their most pressing health concerns. Thankfully, there is a better way, which is why I'm so happy to introduce you to a new sponsor on What She Said, Care to Know. Caretoknow.ca is a free resource where Canadians receive the latest health information, updates on new and existing treatments, and advice from Canadian doctors via email. Over the next 6 months, Dr. Christine Palmay, a family doctor with a special interest in women's health, preventative care, and education, will be joining me to break down some of our most common health challenges. Today, we're kicking things off with a closer look at Care to Know and how it can help you. Welcome to What She Said, Christine.
Thank you, Candace, and thank you for having me.
So, can you tell me a little bit more about your involvement with Care to Know and how it benefits Canadians?
Absolutely. So I've been involved in Care to Know for several years, both as a listener initially and subsequently as a presenter and a speaker. It's a free, as you mentioned, online healthcare resource where Canadians can get latest health information and updates on new and existing treatments. In the ever evolving area of medicine, moment to moment, things are changing. I think you very adeptly said Dr. Google may not be your friend always. I always tell patients to browse at their own risk. So, having a platform like Care to Know that is credible, it is evidence based, and hosted by experts allows you to access information in a safe environment. You don't necessarily have to browse with trepidation on our platform.
It's funny. I have a small anecdote I'd love to share about Google. When after the birth of my daughters, I think I was going through a little bit of postpartum and I was worried that everything was killing me and they would be left alone. You can't control your thoughts. And I would be at the doctor's office constantly with one invented ailment or another. And finally, my family doctor said, please, I beg of you, just stay off of Google.
Absolutely. I actually wrote a prescription for a patient once saying, please stay off Google for 2 months for your mental health and perhaps mine too. But the reality is that access to information is a right. I use Google multiple times a day. But rabbit holes exist, and the anxiety and the stress when accessing information out of context can be really disastrous, and in some cases dangerous. Anything can be posted, so we really have to champion. Having websites that come with not only credibility but integrity, presenting both sides of you from experts in the field.
So, can you tell me then what are some of the topics that the team of experts at Care to Know covers, and how do you keep all of that information up to date and relevant? Science is and medicine is just changing constantly.
Moment to moment evolving. So we have a wonderful team that work around the clock, I think, to keep up to date with the most novel treatments. And because the guest speakers are experts, these are people that have their hands in research and access to updated information. Topics thus far have included diabetes, women's health, hormone replacement therapy, contraception, um, mental health, weight management, hot topics that you see across papers and certainly that I see regularly in my clinic. Upcoming, we have talks on dermatological issues, on irritable bowel syndrome. But I like to encourage the listeners, when you log on and hopefully start subscribing, provide your input because we would like to use our readership and our viewership as a springboard to what to sort of guide what we develop in future episodes.
So, can you tell me then what people can expect when they create an account at Care to Know?
Absolutely. So if you log on to caretoknow.ca, can subscribe, and not only is it free, but it is efficient and hassle-free because you get instantaneous information delivered to your email with reminders on upcoming podcasts, information. Instagram handle is care to know underscore. And we really hope that it will be a regular engagement, hot topics, hot off the pressed issues. And once again, your input as well will guide as we expand our portfolio of topics covered.
So, from over the next 5 episodes after this one, we're going to be talking about some big topics. We're going to be talking about allergies and asthma, menopause, summer skincare, which is very important, diabetes, and weight management, which I'm sure are going to Honestly, just reading through some of the numbers ahead of time of what's coming up, this affects a lot of Canadians. So these are interviews are going to be super important. But of course, in the meantime, people can go to caretoknow.ca to find out a lot more, right?
Absolutely. Information is empowerment, but misinformation can actually be dangerous. So I'm really looking forward to having conversations with you in the next bit.
All right, wonderful. So one more time, then, if you wouldn't mind sharing the website and social channel where people can keep up.
Absolutely. Caretoknow.ca. Sign up, instantaneous emails to your inbox. Instagram handle is care to know underscore.
Wonderful. We'll see you next month.
See you soon.